Well, hello, everybody. Thank you for joining us today. So, I'm down here in the corner. I'm Diana Gasparoni, and I'm the founder of BeWELL Psychotherapy. And I am super excited for our first in a series of live webinar events. And today we have our in-house substance abuse specialist, Becky Kavoussi, who is going to be giving you a presentation tonight about Sober Curious. Substance abuse, maybe it's something that you are ready to take the next steps, or somebody that you love is ready to take the next steps and you want a little bit more information. So I'm going to give you a little bit of information of how this is going to work. She's going to go through a presentation. You can all see, you should have a chat button to the right. You can chat with her throughout the presentation. You can ask her any questions. If it's a big question, she'll come back to it at the end. If it's something that she can answer right away, she will answer while she's there, and there will be a Q&A at the end. So I'm not going to take up too much of your time. I'm going to turn it over to Becky.
Thank you, Diana. Should we give it another minute for people to join? I actually can't see live who's joined yet.
Yeah, we do have a few more people that may be showing up. They can come in at any time. So whenever you're ready.
Okay, great. We'll get started. And aforementioned, I actually can't even see who's here. So thank you all. I can see the list of names. So thank you for everyone who's logged in thus far. I just want to name, I really appreciate you being here with me tonight because it's a rainy day, at least in the boroughs for us in New York and the surrounding areas. We're in a serious pandemic that's impacted all of our lives, and it's an election week here in the United States. So there's a lot going on. So take a breath, gear up. This is going to be a presentation, as Diana mentioned, on just sober curious substance use information. And please feel free to voice yourself in the chat, and I will get back to you. Probably by the end, we'll have a Q&A and a discussion. So a little bit about me. My name is Rebecca Kavoussi. I go by Becky. I'm a practicing licensed clinical social worker, and I am a psychotherapist at BeWELL Psychotherapy. I've been practicing psychotherapy in private practice since 4.5 years, and I've been a clinical working as a social worker since 2014, so about 7 years. Some of my background, in addition to working in private practice, is that I've worked in supportive housing with adults experiencing psychoses who were formerly homeless. And most recently, I'm an associate director at a nonprofit, a bustling, busy clinic, a public center where we provide behavioral health services to the public. I'm really excited to be here tonight, and let's jump into the presentation.
All right, I'm going to do my part over here.
So I've shared my screen. Diana, you can see it?
I can see it small. I'm going to ask, can you all see the presentation? If somebody could just jump up in the chat and let us know if you can see the presentation, that would be great. Oh, I did it.
They can see it? We can see it?
We're all good.
Great. So the impetus for this talk was, again, I'm in private practice at BeWELL Psychotherapy. Here at BeWELL, we treat all walks of life in private, safe, comfortable individual psychotherapy. We typically treat people from the room, but now during COVID-19, we're doing video and virtual services, and that's BeWELLpsychotherapy.com. And, you know, we've noticed as clinicians, and maybe many of you have noticed, that a lot of people during COVID-19 are looking for vices, whether it's food or maybe drinking a little more or smoking a little more pot or cigarette use. There's been a spike in substance use. So this was my introduction slide. I actually already introduced myself, but we're going to be sending it out so you can see it later. at any rate, substance use is normal, right? It is normal until it becomes unnormal. It is transcends every culture, every creed, every walk of life. There is some sort of alcohol in all corners of the planet. Specifically, if you think from a sociocultural lens, you have peyote, ayahuasca. There are hallucinogens that people use across cultures. There, obviously weed, marijuana, cannabis is being legalized in many countries and states. We also have the opioid epidemic that impacts everyone. Substance use, problem, I like to say, when it becomes a problem. Some people find that they might have periods of their life where they might want to take a break, or maybe they are using too much, right? Therapy is a really good way to kind of unpack these behaviors. When we're thinking about addiction and or substance use, I always like to think about, what is the behavior that maybe you're trying to, or that's the behavior, what is that trying to kind of mitigate? Sometimes it can be escapism. Sometimes it can be you're just at a party, right? Like I said earlier, substance uses is a normal part of culture. Happy hours are such a cultural institution. In terms of if you have a problem. So many of you listening, and I think our audience is diverse in terms of some are clinicians, some are therapists, some are just curious, sober, curious people, and some are friends, family, peers. So how would you know if you had a problem? The thing about substance use, which is a topic near and dear to my heart, is only you will truly know if you have a problem. And some of you might have loved ones who've struggled with addiction and substance use disorders. And I know how painful that can be when you're watching someone, just like that train is coming, it's going to hit them and you can't throw them off the track, right? But how might someone learn? How might they know? So typically, if your substance use leads to problematic consequences, such as getting arrested, impeding on your work life, maybe your relationship, maybe your partner's like, listen, you were a little drunk at that party and that was embarrassing, right? You might have an increase in mental health symptoms. People will joke about the Sunday scaries, which is when people have like drank or partied all weekend, and then Sunday they're all anxious for the work week. And it's funny until you think about how that could be acute withdrawal from just the chemicals in your brain causing like a depressive crash, right? And it doesn't necessarily happen to everyone, but mental health symptoms can definitely be increased by substance use. Maybe you have peers or loved ones that have said, hey, it seems like you party pretty hard, and that could be a sign. A big sign is also any guilt or shame when you wake up the next day, or you've been thinking about how you interacted with a person while under the influence. You might be embarrassed, or you might think, I wish I would have handled that differently. It doesn't necessitate that you would have to stop using the substance, but it definitely is worth exploring just to better understand how you can use more safely and use in a way that doesn't promote shame and guilt. So what is addiction? Medical research says that addiction is a brain disease, and this is accurate. But then where does it come from? Because when we think of diseases, we often think of things we can see, maybe something like cancer or arthritis or physical ailments, which are awful, and you can see them, maybe not always, but with addiction, you can't see it, right? It lives in the brain. So we have our genetics, right? Just the genes, the DNA made up from our lineage, and addiction definitely runs in family. And then you have your environment in which you grow up in. Some babies are more resilient than others, but inevitably early attachment, early socialization, that early schooling, these are your environment where the human ego is truly shaped. And if there are any ruptures or adverse effects in the environment, it can lead to mental health issues later in life. We have on the slide here co-occurring mental illness. It's complicated, right? Because addiction in itself is a mental illness. However, it's often co-occurring with another illness. So, for example, I drink because I'm depressed, but I'm depressed because I drink, right? Or so maybe there could be self-medication. If someone does have a mental health issue, maybe they're self-medicating with drugs and alcohol. So it's really, again, a mix of genes and environment. Some populations are in particular more vulnerable just based on sociodemographic, and poverty is a big lead to substance use. However, of course, not for everyone. And I do want to highlight again, this transcends all walks of life, right? Addiction can impact anyone, and there's a lot of stigma and shame around it. And we're going to talk more about harm reduction, which I didn't mention earlier. I'm a harm reductionist when it comes to drugs and alcohol, and I also work with survivors of human trafficking, and we use harm reduction for that too. So whether it's you or a loved one, or maybe you're just thinking about someone you saw on TV, ambivalence is such a pivotal term when you're thinking about addiction and really any behavior. Ambivalence in its simplicity is really feeling two ways about something, and it's a natural part of being a human, right? Our emotions do not exist in a vacuum. It can be complicated, but you can feel two ways about something, whether it's an external situation or an external person or stimuli. So some examples about ambivalence in the context of substance use disorders might be, I love drinking, but I think about quitting sometimes because my hangovers are bad, right? So there's the ambivalence. You love drinking. This is like a big part of you, but your hangovers are terrible, right? So you're feeling two ways about something. So when you utilize something like therapy, you can kind of sway the pendulum either way to kind of figure out what do you really want? And ambivalence doesn't have to be in the context of recovery. We have here, I love my partner, but at the same time, I'm not totally satisfied. I think about leaving them, right? You can be in love and also have apprehension. Maybe you want to invite someone over, but your partner doesn't like them. You want them to come, but you also don't know, right? So feeling two ways about something. So again, when you're whether you're a clinician or you are a patient or you're just a human navigating this world, individuals with addiction deal with ambivalence. They feel two ways about their substance of choice, which is why it becomes really hard to let it go. Because again, you can love something and it can destroy your life. So why might some of us use substances? It can definitely be, just to relax, right? Like the stereotype of getting home after work and having a glass of rosé, or a bottle of beer or something like that, or a casual joint at a party, right? This is maybe some de-stressing behavior. Now it becomes problematic when the behavior again impedes on your life and you feel like maybe you're self-medicating, maybe you have anxiety. Interestingly enough, alcohol hits the same receptors in your brain that benzodiazepines do, which are like Xanax, Valium, Klonopin, Ativan, all of those benzodiazepine, really hardcore anti-anxiety meds that could be very addictive. They hit the same receptors that alcohol do. So it's directly related to anxiety, right? So maybe you're self-medicating with alcohol because you're anxious, or maybe you're not self-medicating. So I want to move into talking about harm reduction because it's an alternative to completely abstaining from substances. So harm reduction essentially just means a healthy change to better prevent further risks. I am a huge proponent of harm reduction. It uses a social justice lens. It's very popular in Canada and, Western Europe. So what it would look like is if I wanted to cut back on drinking, but I didn't want to quit totally, maybe I would only drink on the weekends instead of drinking every day. That would be an example of harm reduction. Condoms are a huge example in the sexuality in the world of sex. Rather, there's a lot of harm reduction surrounding PrEP now people can take to prevent STIs. We have, again, condoms and contraceptives and various things. Something a little more that might seem more extreme for some is like a clean needle exchange. If someone's an opioid user, we have ways so people can get clean needles, and therefore prohibit the spread of hepatitis C. I've worked with a lot of individuals with opiate use disorders. I also want to just sidetrack and say language matters. So when I'm talking about some of these things, like I wouldn't say addict. I would say individual with a substance use disorder or a person with a substance use issue. I wouldn't say that addict, right? So that's one example. So with opioid users or someone, I've worked with a lot of people who had substance use disorder specific to opioid use, and we've done work surrounding, well, do you sniff it or sniff it or shoot it, right? Sniffing is safer than shooting heroin, so therefore that's harm reduction. You're reducing harm in the behavior. And I know this might seem like an extreme example, but with the opioid epidemic being so just present in society, I figure it's worth mentioning the clean needle exchanges. There's also something called Narcan. For those of us who are in New York, we're one of the only cities that it's legal for any civilian to carry Narcan, and it's a nasal spray. So if you see someone overdosing, whether it's on the train or the street, you can give them the nasal spray, and you'll save their life. If they're overdosing, they will snap out of the opioid overdose. Now, if they're just really high, they might wake up at you, but there's no adverse effects of utilizing Narcan. So if anyone has questions about how to obtain training in Narcan, it's really easy. Meet with a trainer for like an hour, and it's free through the state, and you can get a kit and have one. So we can talk about that if anyone has questions. I've met with patients before who told me, I used to drink a lot of hard liquor, and now I only drink light beer, and I feel like things are going a little. So again, these are reduction. Thinking about a behavior, right? So often we come to therapy, we have a behavior maybe we want to work on. So it's our interpersonal relationships and how we interact. Maybe it's issues with our family, our loved ones, parents. Maybe it's substance use issues. And so with therapy, you can really start to use harm reduction in other areas of your life, not just substance use. If you're frustrated with how much you're on social media, for example, you could delete the app from your phone, but you still have your login, right? So that's harm reduction. You can still use the app, but you just have deleted notifications or deleted the apps, right? So this is transferable skills for other behaviors. The next piece I want to talk about, so the slide's intimidating. There's a lot on here. There's no test at the end, so no worries, but the stages of change. So I want to, before I go into the stages of change, that this is not linear, that people can go through these stages in different orders, and they can regress or move forward or stay the same. So it looks different for people, but this is typically when it comes to behavior. You have first so I'll name them all and then I'll explain them. So there's pre-contemplation, contemplation, determination, action, maintenance, recurrence. I went out of order, so I'll go in the right order now. So pre-contemplation is essentially if someone says, I don't have a problem, I don't know what you're talking about, I'm good, right? Pre-contemplation, they don't even realize that maybe there's an issue with a behavior. Contemplation is when you are like, that was bad. I think I do maybe have an issue with X, Y, and Z, right? So you're contemplating, okay. The next step, determination, which I also call preparation, is when you start to think about, okay, maybe I'll schedule a therapy appointment, or maybe up with my friends, or maybe I'll quit drinking for a month, right? That's the preparation and determination. Next becomes action, when you actually physically take the action to change the behavior. So maybe you're going to therapy, maybe you've stopped riding in Ubers to save money, maybe you cut up your credit cards, whatever the action is to fix the behavior, right? In this case, in the context of substance use disorder, since we're speaking on substance use disorders, options include not only therapy, but like maybe the action is I'm going to attend AA or Narcotics Anonymous, or I'm going to go inpatient or to an outpatient facility, right? So after the action, you've taken action, is maintenance, right? So we talk about preventative care a lot in medicine, or in medicine they talk about preventative care. I'm not a medical provider, but in mental health we talk about preventative care as well. You don't have to be in crisis to go to therapy, right? Or to get help. You could maybe utilize treatment just to explore yourself and to prevent kind of the situation. But with maintenance, if you've already had a behavioral change, you want to maintain. So how do you maintain? What does that look like, right? And then finally is recurrence. They say, the powers that be say, Relapse is part of recovery, right? So sometimes it happens. I always tell patients, you said you quit drinking, you had a few drinks, you fell off your bike, you scraped your knee, maybe it bled a little, you put the Band-Aid on, you keep riding. So with the recurrence of the behavior, it's okay. It happens, and then it doesn't negate all of the hard work you've done. You might be sober 365 days of the year, and on the first of the year you drink, it doesn't take back that 365 days, that you've had, right? So relapse happens, and people shouldn't beat themselves up over it. It also makes me think of harm reduction. An example I forgot was there's a lot of, I don't want to say fad, but there's a lot of popular diets out there like keto or Atkins, low carb. And I've had friends say, I do this and it works and I have a cheat day. So on Saturdays, I eat what I want and it's my cheat day. And every other day I eat X, Y, and Z and I work out and this, that. And that's fine. Your cheat day is your harm reduction, right? Instead of binging or eating a lot every day, you have your cheat day. So that was just something I forgot to mention. So again, stages of change. I have no idea I have a problem. Okay, maybe I have a problem. Let me think about how to fix the problem. I'm taking action. I'm going to maintain my current state. And then I may or may not have a little slip up, but that's okay. So if you are or a loved one is thinking about cutting back, I already spoke a lot on harm reduction. The alternative is abstinence. So abstinence is completely refraining from the behavior. So Alcoholics Anonymous, Narcotics Anonymous, 12-step groups are historically based in abstinence, where it's very all or nothing. Either you're using or you are not. AA meetings in particular can be really, really helpful for people. Narcotics Anonymous as well, but they are very black and white. If you, it isn't a space if you're just trying to cut back necessarily. In terms of harm reduction, again, that's kind of like the cutting back piece. Now, abstinence can be a goal of harm reduction, right? You might be like, okay, I'm cutting back on cigarettes and then I'll quit next year. And maybe you will eventually quit and that will be your abstinence. No matter how you want to proceed of taking that break or cutting back, I think if you're even thinking about it, having a safe and sound therapist that you feel comfortable with is really a great place to start. Another place to start is, I think accountability is important. So if you have friends or loved ones that you feel safe sharing with, I think I'm going to cut back on drinking. So if you don't see me drinking out this weekend, that's why. Once you share it, once you put it in the universe, you're held accountable, right? So that could help you cut back. There's also all of these apps you can download, like a sober clock or a behavioral clock, where you can count days if that's helpful for you, right? So again, whether your goal is to completely curtail and stop a behavioral or your substance use, on the flip side, you can also practice just safer ways of managing that. This is a little off topic, but I also do a lot of work, I think I mentioned, with sex workers and survivors of sex trafficking. And in the sex work world, harm reduction is really huge and important because it's a very risky business in terms of police brutality and at-risk kind of situations. So, when I work with survivors, I say who are still in the life, doing sex work. Sex work is different from being trafficked. So people who maybe are in the sex adult industry, just how they can do it in the most safe way, like we mentioned, condoms. So this transcends a lot of things. So you've listened to me ramble. I haven't even looked at the chat, so I'm going to get to it if there are questions. In terms of my approach, I work psychodynamically. I work very relationally. I think that being in the room is great, but right now we have video therapy. I typically listen with a very tuned ear to hear for, therapy can be a window into your unconscious. So maybe there are blind spots that you have that you're not aware of, and it'll come out and I'll hear it and we'll talk about it. I believe everybody has a story. We're all writing our own stories. I bring my own self to the room, but when I'm in the room, I also, it's about you and how we work together and just meeting you where you are. I think it's important to have short-term and long-term goals. And remember, you can break those goals into baby steps. They don't have to all be accomplished at once. I used to work at teenagers and they were all like, I'm going to get my license tomorrow. Oh, okay. You're going to get your license tomorrow. let's break down that goal into baby steps. So first, identifying your DMV, identifying how you're going to save money for your permit test and your driver's ed classes, right? There are steps to reach your goal. So again, my approach is pretty laid back, but I take it very seriously, and I have a warm approach where I really listen to what you're saying, so we can kind of understand what you're really trying to say. So that's me. I believe this is our last slide. Again, I encourage after the Q&A, people can visit our website, BeWELLpsychotherapy.com. If you or anyone you know is looking for therapy, we're taking new patients. We have beautiful offices in Midtown East, and eventually we can see you there. But for now, we're seeing people online. So with that, that is the end of the slideshow. So I'm going to figure out how to stop sharing my screen. Oops. And get back to you all. I just want to make sure I've stopped sharing. I believe I stopped sharing my screen. So people mentioned addicted to the phone. Yes, I think it is really hard with phones. So I am a social media junkie because I get a lot of my, clickbait news, quick headlines from there. I've moved around a lot, so I keep in touch with friends on social media. And when you click on your social media, it actually releases dopamine, so it is addicting. So it's something to keep in mind, especially since it's hard to separate work from life balance, and a lot of our work and personal stuff is on our phone. So nothing wrong with having a phone, but definitely being mindful of that. Carrie had mentioned harm reduction feels less judgmental than abstinence, which is also why I approach my work that way. Thank you, Carrie. Carrie is a clinician who works with individuals in the criminal justice system, and I really appreciate that. Abstinence as an outsider, if you're trying to get someone to be abstinent, yes, it does. Agree that it can feel limiting and judgmental, but it is a really good fit for some people. So, we have a few minutes left. I really appreciate everyone who showed up tonight. If anyone wants to ask any final questions, please do in the chat before we log out. Take care of yourselves this evening. If you find yourself feeling some type of way, as they used to say, during this time, it's normal, right? This is a pandemic. So please take care of yourself tonight. And it was really nice talking to you all. And thank you for listening. And you're welcome all. Diana likes knowing about the dopamine release from their phone. Yeah, it's very true. It lights up the pleasure center. It's so bizarre, but it's true. And also eliminate screen time before you go to sleep, which is also hard because it can make it hard to go to sleep because it buzzes your brain. So thank you all. Diana, is there anything else you wanted to add?
No, I learned so much. Thank you. My phone addiction has been real in COVID. I'm not gonna lie. I am like
You're running a business.
I'm trying to like figure out ways to like, you can't put your phone in the freezer, which is what my first choice was gonna be, but I'm like, where I'm gonna put it, like not sleep with it next to my bed. I wasn't even thinking about the dopamine release. And I love the harm reduction approach. I think I know that abstinence for some people is really important from wherever they are, whatever their drug of choice is, but I think that like harm reduction is less judgmental and also gives a person time to get to know themselves in a new way. So and see how it's going to work. I myself have worked in harm reduction. So and with that model, I use that all the time. Thank you, Becky. That was wonderful. And this presentation has been recorded and will be up on Crowdcast and on the website. So if you missed anything or you want to share it with your friends, somebody who you may think needs this information, there's always somebody close to us that could get a little bit more informed. Please share it. BeWellPsychotherapy.com/events. And yeah, you'll get a feedback email from us tomorrow. So we really appreciate your time. And Enjoy your Thursday night. Everybody stay dry and warm and safe. Wash your hands, wear
Thanks
your
so much,
masks, do
Diana.
your things.
Diana, one more thing. Carrie
Yeah.
said harm reduction is leaving your phone in the living room when you go to bed.
Oh,
So that
thank you, Kay.
um, uh,
Thank you. I love it.
quick side note, I turned off my phone recently and then I'll shut up, I promise, just to see how often I was impulsed to grab it. And it was embarrassing. So it's all a
Yeah,
work in progress. So
all a work
again,
in
thanks
progress.
again, Diana, and thanks for the reminder about the masks.
Yes.
And everyone stay safe.
Okay, thank you so much.
Good night.
Okay, good night.